So what we're trying to create here with the residency program, and especially these rural rotations, is the chance for a resident to practice full scope pediatrics and be really responsible for the care of pediatric patients on the outpatient setting in a rural area. So some of the challenges in rural areas is that sometimes you're the only pediatrician. Not only are you the only pediatrician, but there aren't any specialists for kids. So if a kid has diabetes, they'd be seeing a pediatric endocrinologist, and for that you'd have to travel hours to see them. And so a rural pediatrician will have to coordinate care with specialists across time zones and over phone calls and telehealth visits, and be really involved in helping manage extra needs of their patients. And so in exposing residents to some of the challenges of rural pediatric care, even if they choose to live in a city and work someday, knowing what goes on in a rural area and some of the challenges we face is really important.
The opportunity to practice medicine multiple times throughout your residency in a rural setting is really unique to this residency. In a rural setting, you have to learn how to care for patients in creative ways. You have to solve problems creatively. When you are at a children's hospital, everything is geared towards caring for kids. When you're out 5 hours away from a children's hospital working at an adult community hospital, nothing's geared towards kids. And you have to figure out how you're going to problem solve, how you're going to handle the sick kid in the ER. It's a great opportunity to learn how to work with all different types of providers and staff members in the community who may not be trained in working with kids. You learn how to work in lower resource areas, and I think if you learn how to care for kids in a rural area where your resources are limited, you can care for kids anywhere.
So the rural component, I think, is really important for a number of different reasons. For the residents, it really is an opportunity to practice more independently and to also see just a different shade of pediatrics. It also is a place where you need to have more of a complete game. You don't have an endocrinologist down the street. You don't have a cardiologist that is a 15-minute drive away. So it's really learning to create your own assessments and plans with maybe just some telephone consultation. It's just a different skill set.
When I was training in a big city, learning about pediatrics, doing pediatric residency, I didn't really know what it meant to be a rural pediatrician or even a pediatrician until I went and rotated through outpatient rural clinics, where you see doctors providing long-term care to children as they grow up and have their own children, and you really become part of their family. To have that relationship with parents, so they trust you with all of their fears and their successes. And now I'm getting teared up. Now that I've been here like 5 years, I'm walking down the streets at the farmer's market and everyone's like, "Hi, Dr. Day," and they're hugging me. But I'm also running into the hospital, I'm resuscitating somebody who's sick or saving lives, and then seeing them on the outpatient clinic as they grow up. It's really, really powerful. And so that's the relationship I was looking for when I sought out a rural pediatric full scope job.
So opportunities of where the rural rotations will be are kind of across the board. So again, Boise's our main kind of urban area, but outside of Boise, you don't have to go too far and you're in a rural area. And so the hope is that our residents will have an opportunity to go to northern Idaho, such as Moscow, McCall areas, or down into southern Idaho, such as Emmett, Wood River, Magic Valley, those types of areas, and so that they can really see the difference of population needs based on where they physically are.
Well, here in Moscow, we have an outpatient clinic, and it's right across the street from the hospital where we attend deliveries and see newborns and take care of sick kids in the ER or in the inpatient ward, or even sometimes in the ICU. So our day-to-day is we maybe round on a newborn or somebody who's admitted to the hospital, and then we come across the street and we see well childs and sick visits and take care of kids with depression or anxiety. And it could be that all of a sudden we get called over to the hospital to see a sick kid who needs us, and then we're back over here at the clinic finishing out a day
And for sure, the rural pediatrics piece is incredibly important to our state. We have communities in our state that it's a 3 to 3.5 hour drive to the nearest pediatrician. They have family medicine physicians that are excellent out there, but they don't have the ability to get a pediatrician consult. And they don't have any pediatricians, close to them. So this is an opportunity to actually reach out into those communities, place pediatric residents, know that the pediatric residents can then obtain telehealth consults with their attendings back here in Boise in our residency program, and really benefit the residents in rural Idaho as well as the resident in their education.
I think we're hoping with all the rural sites in this residency program and Moscow is you'll be out in beautiful areas, because Idaho is beautiful. So surrounded by mountains and rivers and lakes, and being able to enjoy your time when you're not at work.